My name is Ceri Battle and I'm a consultant physiotherapist in critical care in Morrison Hospital, Swansea. Firstly, thank you to Health and Care Research Wales for selecting me to present our abstract, Critical Care Research in Wales, a Survey Study. So as you can't see who is doing this presentation, for those of you who don't know me, this is me. One of my professional roles is to lead the Welsh Intensive Care Society Audit and Research Group, or WICSAG, which is made up of a group of clinicians from various professions across the MDT working in critical care in 14 acute units. As a group, we support individual clinicians undertaking studies using most, if not all, of the units across Wales. As a result, we produce good quality, multi-centre observational research without funding, but using willing principal investigators at each site. We all know that evidence now shows that healthcare systems that actively engage in clinical research report better patient outcomes. A key action of the Welsh Government's Critical Care Delivery Plan was to increase the number of critical care healthcare professionals engaged in clinical research. On a wider global scale, the evaluation of interventions designed to improve outcomes for critically ill patients is a key international priority. But effective critical care research requires collaborative working between engaged enthusiastic clinicians, research teams and patients and their families, in addition to adequate time, research infrastructure, governance, institutional and academic support. We know we do have all that in Wales, but more importantly, do the workforce in critical care believe we have all those components? And finding this out was the key driver for our most recent WICSAG study. Limited evidence exists regarding both nursing and AHP understanding of the critical care research process and their perceptions of such research in general. Understanding these attitudes and experiences is an important research priority, as the successful delivery and completion of research in a critical care environment is dependent on engagement of both nurse and AHP staff. So the aims of our study were to A, investigate nurse and AHP personal experience of working in critical care research, B, describe environmental characteristics that influence the research culture on critical care units, C, describe nurse and AHP attitudes towards research, and D, compare differences between nurse and AHP attitudes. Ethical approval was not needed for the study, and the R&D department of each participating site confirmed local approval. We used a cross-sectional questionnaire design in which all nurses and AHPs, including physios, occupational therapists, dietitians, pharmacists, speech therapists and psychologists, working in the general intensive care units in Wales, were invited to complete either a paper-based or online questionnaire. Of the 14 ICUs, one was unable to participate in the study due to a lack of available principal investigator. A previously developed questionnaire was used for this study with the permission of the authors in Canada. The questionnaire consists of 4 sections: research experience, ICU or hospital characteristics, attitudes about research, and demographic data. Respondents are required to complete 64 close-ended Likert scale response questions and a free text open-ended comment section. Statistical analysis ranged from the basic descriptive techniques through to more complex techniques such as factor analysis and linear regression analysis performed by our statistician Timothy Driscoll from Swansea Trials Unit, and that examined the relationship between the different attitude and environmental factors within the survey. So what did we find out? The overall response rate was 55%, which worked out as around 600 members of staff across Wales, with 91% of total respondents being nurses and 9% being AHPs. The response rate of the nurses on the top row was 53%, compared to AHPs on the bottom row, which was 98%, but in fairness, the AHPs was a much smaller group. I've not included a table of demographics of respondents as there is too much data for one slide, but as you would expect, most respondents were degree level, nurses, female, with variable experience, working full-time. The results of the study will be published by the time of the conference, but I've tried to summarise them into this one slide for the purpose of the presentation. From the results, we were able to identify a number of themes that could be addressed at unit level to improve nurse and AHP engagement in research. The first theme was communication. Staff requested a full explanation of each study before the study is opened on the unit, and they also wanted regular updates regarding study progress and results during and after the study. They suggested a number of methods for improving communication, and these included the use of posters around the unit, a social media page, an annual report, and a research notice board. They also thought that champions or teams of champions who are given the role of promoting research across the whole MDT would be useful. They also thought that the use of plain language was key to improving communication. The second theme was improved managerial encouragement or support to participate in research. Staff felt that more dedicated ITU split clinical and research posts would be useful, but for all the MDT, not just nursing staff. They also wanted protected time to participate in research and funding or time to attend training on research topics, which was often available in-house. The third theme was the idea of translating research into practice, and they suggested that a forum should exist in which practice change can be discussed based on the research findings. They wanted local regular research meetings that are more inclusive and accessible to nurse and AHP staff groups, and the possibility of annual unit level or national level events that showcases the research work and results from around Wales. The final theme was an overall lack of understanding of research processes, so staff suggested in-house training by research staff for clinical nurses and AHPs of key processes. They thought that there could be more widespread involvement of bedside nurses and AHPs in research, especially in units where dedicated research nurses exist, and there's an opportunity for the bedside staff to be more involved. And finally, they wanted more active encouragement to become involved in research with protected time by managerial staff and active encouragement to attend local and national critical care research meetings. And then coronavirus hit. I'm not sure yet what impact this has had on critical care unit research across Wales, but from my own experience of running the urgent public health studies in Morton Hospital, something good actually came out of the pandemic. Despite the indescribable pressure on critical care clinicians, nurses and AHP staff, they wanted to be engaged in research during this time. They wanted to know what we were researching and why. They wanted to do everything they could to help. So I wonder whether the results of our study are still accurate. But what is key for us as critical care researchers in Wales is to make sure that this new enthusiasm for research isn't lost when COVID is finally a thing of the past. So, as we found in our research, dissemination of the results is now key. The paper is about to be published, or by the time of the conference will have been published in JICS, the Journal of the Intensive Care Society, so will be freely accessible to all staff. We've already summarised the key findings and circulated them to our critical care leads and research leads in all Welsh units, and we have requested that these results be disseminated across the whole MDT workforce. Thank you for listening to my whistle-stop tour of our study. I've included my contact details and my Twitter handles for anybody who wants any of the references or a copy of the paper so you can read the results in full. I'd also like to thank all the critical care staff who completed the survey and also those who worked as PIs on the study. These are all the staff who worked as PIs, so thank you very much to them.